Hello, my name is Chatushka Samradivakara and today I am going to do my presentation about Cushing's disease. This is my name and the date that I am doing my presentation, and I am using this as a flashcard. The first one is Cushing's disease. Cushing disease is an excessive production of adrenocorticotropic hormone by the body, also known as hypercortisolism. The classification and the etiology of the disease is that Cushing disease falls under the Cushing syndrome. There are three important forms of Cushing syndrome. The first one is the pituitary form, which results from excessive production of adrenocorticotropic hormone by a tumor of the pituitary gland. The second form is the adrenal form. It is caused by a benign or a malignant adrenal tumor. The third form is ectopic Cushing syndrome. It is caused by a non-pituitary adrenocorticotropic secreting tumor such as a small cell carcinoma of the lung, as it secretes ACTH or rarely CRH and produce Cushing syndrome. Cushing syndrome can also result from long-term therapy with one of the potential pharmacological preparations of glucocorticoids, and this form is called iatrogenic Cushing syndrome. The next one is clinical manifestations. The major manifestations of Cushing syndrome represent an exaggeration of the many actions of cortisol. Altered fat metabolism causes a peculiar deposition of fat characterized by a protruding abdomen, subclavicular fat pads or buffalo humps on the back, and a round plethoric moon face. There is muscle weakness and the extremities are thin because of protein breakdown and muscle wasting. In advanced cases, the skin over the forearm and legs become very thin and having the appearance of a parchment. Also, purple striations, stretch marks from stretching of the catabolically weakened skin and subcutaneous tissues are distributed over the breast, thighs, and abdomen. Osteoporosis may develop because of destruction of bone proteins and alterations in calcium metabolism, also resulting in back pain, compression fractures of the vertebra, and rib fractures. As calcium is metabolized from bone, renal calculi may develop. The glucocorticoids possess mineralocorticoid properties. So, it causes hypokalemia as a result of excessive potassium excretion and hypertension resulting from sodium retention. Inflammatory and immune responses are inhibited, resulting in increased susceptibility to infection. Cortisol increases gastric acid secretion, which may provoke gastric ulceration and bleeding. An accompanying increase in androgen levels causes hirsutism and mild acne, menstrual irregularities in women. Excess levels of glucocorticoids may give rise to extreme emotional liability as well. Children with Cushing syndrome tend to have obesity and grow more slowly than other children. Women may have excess hair on their face, neck, chest, abdomen, and thighs. Menstrual periods may become irregular or stop. Men may decreased infertility rates and lowered interest in sex and have erectile dysfunctions as well. Not everyone with Cushing disease have all these symptoms, which can make it hard to detect. Now, the next one is the important diagnostic tests. The diagnosis of Cushing syndrome depends on the findings of cortisol hypersecretion. The determination of a 24-hour exertion of cortisol in urine provides a reliable and practical index of cortisol secretion. One of the prominent features of Cushing syndrome is loss of diurnal patterns of cortisol secretion. The overnight 1 milligram dexamethasone suppression test is also used as a screening tool for Cushing syndrome. Other tests include Measurements of plasma levels of adrenocorticotropic hormone, and the adrenocorticotropic hormone level should be normal or elevated in ACT-dependent Cushing syndrome, such as Cushing disease and the ectopic ACTH, and low in non-ACTH dependent Cushing syndrome, such as adrenal tumors. Various suppressions or stimulation tests of HPA system are performed to delineate the cause further, and MRI and CT scans afford a means of locating adrenal or pituitary tumors too. Briefly explain one differential diagnosis. Cushing syndrome may be mistaken for other conditions that have many of the same signs, such as polycystic ovarian syndrome or metabolic syndrome. Polycystic ovarian syndrome is a condition in which women may have high levels of male hormones, increasing the chance for irregular or absent menstrual cycles, infertility, obesity, ovarian cysts, heart diseases, and diabetes. This illness is linked to insulin resistance too. Mention possible complications. Cushing syndrome can cause health problems such as heart attack and stroke, blood clots and in legs and lungs, infections, bone loss and fractures, high blood pressure, unhealthy cholesterol levels, depression or mood swings, memory loss or trouble concentrating, insulin resistance, and pre-diabetes and type 2 diabetes as well. But although Cushing syndrome can usually be cured, it can be fatal if not treated. Thank you.